Leaune-Welt suggests that all follow-ups and deliveries happen with a competent healthcare professional who has a right to practice in Quebec. There are two ways you can be followed for your pregnancy. The first is with a doctor, the second with a midwife. Let's start with the doctor. Finding a doctor to follow your pregnancy can be a difficult task, and it is very important to start your research as soon as possible. At this moment in Quebec, it is very hard to find a doctor for everyone. You will have to make many calls and be very patient. In Quebec, you can be followed for your pregnancy by a family doctor or a gynecologist. Usually, gynecologists follow high-risk pregnancies. You can find online a document that lists all of the family doctors that do pregnancy follow-up. To find this document, please consult the following link. There is also a website you can consult where there is all of the gynecologists who practice in Quebec. When you're trying to find a doctor, there are important questions to ask when you make your calls. The first question to ask is if they accept or not to follow women who don't have medical coverage. The second question to ask is what are the fees for the doctor? It changes from a doctor to another. The third question to ask is, are there other fees? Is there administrative fees or other fees that you need to know about? The meetings you will have with your doctor usually happen outside of the hospital, either in their office or at an external clinic. Know that some doctor will only accept to follow you if you make the deposit to the hospital before actually starting the follow-up. If that happens, continue calling because it is not all of the doctors that ask for that deposit. Let's now talk about midwives. So when you're pregnant, you can also be followed for your pregnancy by a midwife. A midwife is a healthcare professional who can be entirely responsible for your pregnancy follow-up and for the delivery of the baby and for the post-delivery of the baby up to 6 weeks after the delivery. Midwives can only follow women who have normal pregnancies. If complications occur during the follow-up, then they will have to transfer your follow-up to a doctor. Midwives won't accept to start a pregnancy follow-up after 30 weeks of pregnancies. So if this is something that you would be interested in, it is very important to start calling birthing centers as soon as possible. So how does a pregnancy follow-up look like in general? In Quebec, the usual meeting sequence for a normal pregnancy is first meeting around 12 weeks of pregnancy. Then between the 12th week of pregnancy and up to 28 to 30 weeks, you would be seeing your doctor or midwife every month. Then from the 28 to 30 week of pregnancy up to 36 to 37 weeks, the meetings would be every 2 weeks. Then starting the 36th week until the birth of the baby, you would be seeing the doctor or the midwife every week. Note that this is not a universal norm. This might change from a province to another, and this might also change from a country to another. The meetings with your doctor can sometimes feel very short. Know that, however, even if it is short meetings, these meetings are important and allows your doctor to know if your pregnancy is going as planned and if there should be any concerns for you or for the baby. During your follow-up, many different elements will be evaluated by your doctor or midwife. This includes your health history, measurement of your blood pressure, measurement of your weight, some urinary tests will be done, the height of your uterus, they will be listening to the heart of your baby, and they will take some blood tests, and of course also ultrasounds would be asked.